Welcome to The Explainer. Today, we are breaking down the prescription medication Fenofibrate. It's a powerful tool that doctors use to help manage the fats in your blood. So here's what we're going to cover. First, what problem are we even trying to solve here? Then, how does this drug actually work inside your body? Who is it for? We'll also get into the major warnings. This is super important. And finally, how you and your doctor can use it safely. Okay, so first things first. To really get what Fenofibrate does, we need to understand the problem it's designed to fix. You've probably heard your doctor use terms like high triglycerides or maybe dyslipidemia. It sounds complicated, right? But really, all it means is that you have abnormal levels of fats or lipids just kind of floating around in your bloodstream. And it's so important to get this. This isn't just about numbers on a lab report. We're talking about managing these fats as a way to proactively protect your heart and your brain from some really serious health problems down the road. So how does this medication actually get the job done? Let's pop the hood and take a look at the engine. Okay, Fenofibrate has a very specific target inside your cells. It's called PPR alpha. Now, the easiest way to think about this is to imagine it's the body's master control switch for how it handles and breaks down fats. And what happens next is this brilliant little chain reaction. So Fenofibrate comes in, and it flips that PPR alpha switch into the on position. This immediately activates what you can think of as a fat cleanup crew. It's an enzyme, which then gets to work breaking down and clearing all those extra triglycerides right out of your bloodstream. Now, check this out, because here you can see the results of that whole process. Its biggest, most powerful effect? It drastically lowers triglycerides. I mean, that's its main job. But it doesn't stop there. It also gives a nice little boost to your HDL, that's the good cholesterol, and it helps bring down your LDL, the bad kind. So knowing how it works kind of gives us a big clue about who this medication is really for. Who's the ideal person to use this specific tool? Well, according to its official approval, Fenofibrate is really meant for two main situations. The first is for people with what's called severe hypertriglyceridemia. That just means extremely high levels of triglycerides. The second is for something called mixed dyslipidemia, which is basically a triple threat, a mix of high bad cholesterol and high triglycerides, often with low good cholesterol. And just to give you some context, when doctors say severe, what do they mean? We're talking about triglyceride levels that are over 500. At that level, the immediate worry is often about preventing a really painful and dangerous condition called pancreatitis. All right, I need your full attention for this next part. This is, without a doubt, the most important section of this whole explainer, understanding the rules and the risks that come with this medication. Look, Fenofibrate is a really effective tool, but just like any powerful tool, it's not without some significant risks. You and your doctor absolutely have to be aware of these to use it safely. So the FDA puts what's called a boxed warning on certain drugs. It's the most serious alert they have. Fenofibrate has two of them. The first is a risk of serious muscle injury that can even lead to kidney failure, and this risk goes up when you take it with statin drugs. The second is the potential for liver damage, which is why your doctor is going to be keeping a close eye on your liver function. This is a direct quote from the official safety information, and it is 100% non-negotiable. Any kind of unexplained muscle pain, any weakness, any tenderness, especially if you just feel kind of unwell or have a fever with it, you have to tell your doctor about it right away, immediately. Now, here's something really strange, a little bit of a paradox with this drug. On the one hand, like we just talked about, it's used to prevent pancreatitis in people with those sky-high triglycerides. But on the other hand, for a very small number of people, the drug itself can actually cause pancreatitis as a side effect. It's rare, but it's a really important risk to know about. And beyond those big boxed warnings, you should also be aware of a few other potential risks. These include possible effects on your kidneys, a slightly higher risk of getting blood clots in your veins, and the possibility of developing gallstones. Okay, let's finish up by focusing on the practical stuff. What do you and your doctor need to do together to make sure this medication is working for you safely and effectively? This is critical. Fenofibrate can interact with other common medicines, like the blood thinner warfarin. That makes it absolutely vital that every single one of your doctors has a complete list of every medication and every supplement you are taking, no exceptions. Taking Fenofibrate isn't a set it and forget it kind of deal. Using it safely means having a regular monitoring plan. This is going to involve routine blood tests to check if your lipids are getting better, to keep an eye on your liver and kidney function,
and to check for muscle enzymes if you start having any pain.
So, what this all boils down to is that this medication is part of a team effort. You have to remember it's in addition to a healthy diet and exercise, it's not a replacement for them. And your job, your responsibility, is to be proactive and report any of those key warning signs. Muscle pain, signs of liver issues, severe stomach pain, you gotta report them right away. At the end of the day, Fenofibrate is a powerful tool, for sure, but it is not a simple fix. Success with it really depends on an active partnership between you, your doctor, and the medication itself. It demands attention, it demands communication, and it demands commitment to make sure that the very real benefits always outweigh the very real risks.